Hey there, everybody, and welcome back. We are continuing the nursing school mindset edit, where every day we talk about a simple mindset shift that you can make if you're starting nursing school or maybe heading into your next semester. So let me know in the comments where you are watching from so I can see who is here. And today we're talking about feedback. And I am super guilty of this, and probably why I wanted to talk about it, because I'm one of those people that's super fearful of feedback. And when you are in nursing school, you will get so much feedback that it can be a little bit overwhelming. And if you're kind of wary of feedback like I was for a long time, it can be really stressful. And that's simply because of how you view feedback and how you view kind of your reaction and how it reflects on you. So, we're going to talk about that today. So, I would say the biggest kind of problem that students have with feedback is how you're viewing it. So, put a thumbs up in the comments if you view feedback as criticism, like a negative criticism of you personally. Okay. If that's how you view feedback, we're going to try to shift that today. And I want you to start thinking about feedback simply as information. It is simply information that is absolutely there to help you improve. Okay, so when you look at feedback that way, it becomes a really positive thing, right? It is actually one of the best gifts that you can receive as a nursing student. It is a super valuable form of data, and it is absolutely the pathway to success. Okay, so there are two general ways that nursing students accept feedback. Okay, the first way is we brush it off, especially, well, we brush off positive feedback a lot of times. So let's say you score really high on an exam. A lot of times, what we do is we say, "Oh, I just got lucky." How many times have you said, "Oh, I just got lucky," or "Oh, that person just grades really easy," or something like that when you get positive feedback, okay? The problem with accepting positive feedback in this way is that it doesn't allow you to take ownership of your accomplishments and kind of own how amazing you are. So, especially if you have imposter syndrome, which we're going to talk about in depth in an upcoming video, especially if you have imposter syndrome, you might be doing this. So, if you do this, I want you to check back in with me when we talk about imposter syndrome. Probably the more common form of feedback that students have trouble with is that negative feedback, that critical feedback, right? And when we receive that critical feedback, it often just makes our brains flip into this mode where it starts to cycle through this confirms everything I've ever thought. I don't belong here. I'm not going to survive in this program, etc., etc. That also ties in really strongly with imposter syndrome. So we're going to tackle that later. It's a big topic worthy of its own discussion. But let's just talk about some very simple things that we can do to change how we accept and view feedback. Okay, so let's say that you get some critical feedback. Okay, and critical does not equal criticizing. Okay, I want you to understand that. Critical does not mean criticizing, but it can feel a little bit personal, right? So, how do we accept that kind of feedback without it spiraling us into this kind of negative self talk place? So, the first thing I want you to do when someone gives you that critical feedback, pull yourself out of it. Try to pull your personal feelings out of it. I want you to understand that the feedback is not about you as a human being or as a nurse or as a future nurse or a nursing student. It's simply feedback about a performance on an assessment of some kind, whether it was an exam or some skill that you performed in lab or in clinical, something like that. You are not the exam or the assessment, and the assessment is not you. You have to pull your personal feelings out of it. And again, critical does not mean criticizing, okay? Think about critical thinking, right? We learn that skill as nursing students. We use it all the time as nurses. That critical thinking helps you make connections, right? It helps you make connections between concepts. It helps you make connections between here's what I see going on with my patient, here's what I'm going to do about it, here's what I expect to happen, etc., right? It connects you from where you are with the patient or the situation to where you want to be, the outcome that you want to achieve. Critical feedback is the same way. It gives you data about where you are now and basically gives you a very simple roadmap to where you want to be. So it's super, super valuable, okay? Someone basically just told you exactly what to do to improve and be successful. So again, I look at critical feedback as a gift, okay? Definitely not as a negative or as criticizing. So I know I've been super guilty of this as well. When someone gives that critical feedback, your initial reaction could be to get defensive, to kind of crawl into your shell, maybe, especially if you're kind of shy or an introvert. But can we take ownership of these learning opportunities that critical feedback present to us? Okay, that is the absolute key here. Looking at it as a learning opportunity and a pathway to growth and success. So instead of feeling like negated or downtrodden or attacked or diminished by critical feedback, I want you guys to rise up to the critical feedback because you're going to view it as a gift and a roadmap to you thriving and being even more successful. So sometimes I find students do better with this if I give them like more specific things to say in that moment. So I don't know if you saw, I did a Instagram or a Facebook post, maybe it was both. Was it yesterday or this morning? I can't remember, but it was recent. And the message was basically if somebody gives you feedback and your first words are, yeah, but, and you start getting defensive, you're going kind of down the wrong path. Instead, can you say something super simple like, thank you for the feedback. I do remember you telling us to do X. I will be sure to do that next time. Thanks for the reminder. Super, super simple, okay? And then you go on with your life, right? So when someone gives you that critical feedback, instead of going down the defensive or trying to kind of argue your way out of it or even push blame off on something else, you have to start learning this habit of taking ownership because that's what you're going to be doing at the bedside. As the RN, pretty much everything falls down on you. And you guys, I know I've said this a bunch of times, you don't really understand the weight of that until it's happening to you all the time. So taking ownership is absolutely huge. So thank you, and I will work on that. Thanks for the reminder, et cetera, et cetera. Now, if you do need to kind of think through the actions and the processes, that's perfect. You can do that with your instructor or whoever's providing the feedback in that moment. But make sure you're not doing it from that kind of defensive standpoint because that's not going to open your mind up to accepting new learning, okay? Be very open and seek answers more than you try to provide justification, okay? Especially in this novice stage that you're at right now when you are learning so much and you don't know yet what you don't know. But as you get more exposure, you start to learn and you start to grow more. Now, if you feel like I could do that, I could say thank you, I could acknowledge, I could move on with my life and not let that feedback spiral me into negative despair, but use it as a way to lift myself up to a higher level of performance. Awesome. can we take that even to a higher level? Okay, this is where it gets hard, but I promise if you guys start using this technique, it does get easier and you will be astounded at how quickly it can help you grow. And that is to actually seek out feedback. So I know it's super scary because you might be opening yourself up to getting that critical feedback, right? But by doing that, you are conveying a massive amount of confidence and your willingness to accept that you don't know everything and you are super eager to learn. And that is huge. That is what is going to help you just skyrocket your clinical learning, your learning in nursing school, and your competence as a bedside nurse. So simply, approaching whatever person maybe who observed you doing something, do you have any feedback for what I could do differently to improve for next time I do a wet to dry dressing change, or a head to toe assessment, or an interaction with an angry family member, whatever it is. And most of the time, that individual is going to be able to give you some really solid feedback on that. Okay. So the takeaways for this are: feedback is not personal. It's not an attack on you as a human being, I promise. It is provided because the person who really cares about your abilities to be a safe and confident nurse is giving you this gift to help you get to that next level. And then if you do want to take it to an even higher level, go and seek out feedback from people that you trust. Okay? All right, you guys. I like what Kalaya, I hope I'm saying your name right, says, trying to remember that they want me to succeed. Absolutely. And for that to happen, you have to know. You have to know what the right way to do things is, and you appreciate that feedback. That's an awesome, awesome attitude. And yeah, it absolutely helps you grow, and it just takes your competency to that next level just so much more quickly. So I want to thank you guys for attending today. And tomorrow we're talking about test anxiety, which I know is a big issue with nursing students. That will be at 4 o'clock Pacific. So I will see you same time, not same time, but the same place, 4 p.m. Pacific tomorrow, which is Sunday, July 25th, to talk about test anxiety. Okay. All right. Yep. Monica totally is on board with this. Awesome. All right. Thanks, everybody. See you tomorrow. Bye.